Buenos días a todas y a todos los
Good morning,
participantes de las
everyone,
campañas de manera
and to
virtual
all the
de
attendees
28
that are
países,
joining us today
Anguila,
virtually.
Antigua y
First of all,
Barbuda,
the Antigua and Barbuda,
Argentina,
Anguilla,
Belice,
Argentina,
Brasil,
Belize,
Chile,
Brazil,
Colombia,
Chile,
Ecuador, El
Colombia,
Salvador,
Ecuador,
España,
El Salvador,
Guatemala,
Spain,
Honduras,
Guatemala,
México, Panamá,
Honduras,
Perú,
Mexico, Panama,
República Dominicana,
Peru,
Santa
Dominican
Lucía y
Republic,
Uruguay. A
Saint
todos,
Lucia,
cordial
and
saludo
Uruguay.
y
Thank you very much and welcome
bienvenidos.
everyone.
El Centro Interamericano de
The
Estudios de Seguridad
Inter-American
Social,
Center
CIESS,
for Social
les da la más
Security
cordial
Studies,
bienvenida al
CIESS,
encuentro hacia
welcomes
una
you
vida
to the
plena
CIESS
y una
Sessions
visión integral
towards a
del adulto
fulfilling
mayor en las
life, a
Américas.
global vision on the elderly
Agradezco
in
la
the
participación
Americas.
de nuestros
I'm
distinguidos
grateful for
panelistas
the
y de todos
participation of
ustedes
our
quienes hacen
distinguished panelists
posible este
and all
encuentro.
of you who make these
Es
CIESS
con
sessions
gratificante la
possible.
participación de la
We are
maestra
pleased to
Yolanda
have the
Benavides Murillo,
intervention of
directora ejecutiva
Ms.
del Consejo
Yolanda
Nacional
Benavides
de la
Murillo,
Persona Adulta Mayor
Executive
de
Director
Costa
of the
Rica,
National
la
Council
doctora
for the
Mónica Roque,
Elderly of Costa
presidenta de la
Rica,
Asociación
Ms.
Latinoamericana de
Monica Roque,
Gerontología
who is the
Comunitaria de
President
Argentina,
of the Latin
y del
America
licenciado
Association
Daniel
of
Graffini,
Community
gerente
Gerontology of
banco de
Argentina,
Provisión Social del
and
Uruguay.
Mr. Daniel Grafiña, Vice President of
Los
the Social
encuentros
Security
CIES
Bank
son
of
eventos
Uruguay.
importantes
The
para el
CIESS
intercambio de
are
información
important
sobre las
events for
realidades
the
y
exchange
desafíos
of
de los
information
sistemas de
on the
seguridad social en
realities
las
and
Américas,
challenges of Social Security
desde la
systems in the
perspectiva de la
Americas.
y el experto
From the
invitado.
perspective
Se
of the
exploran las
experts,
condiciones, características y
we can
experiencias de la
provide the
región
conditions,
en busca de
characteristics, and
soluciones
experiences of
efectivas
the region
orientadas a
region
mejorar
that
el
will be
bienestar y la
explored
calidad
in
de vida de las
searching for
poblaciones
effective
mayores.
solutions aimed
Los
at
encuentros
improving welfare and
fomentan
quality
el
of life of
aprendizaje
the elderly
colectivo,
population.
el diálogo y la
These CIESS
colaboración
sessions
entre
promote
profesionales,
collective learning,
permitiendo
dialogue, and
un mayor
collaboration among
entendimiento de los retos y
professionals,
oportunidades en la
allowing
seguridad
us
social en las
for a
Américas.
better understanding of the
La
challenges and
relevancia
opportunities
de
in the
estos
Social
encuentros
Security and the Americas.
radica en la
The relevance
posibilidad que
of
brindan
these CIESS
para
sessions
intercambiar
lies in the
enfoques y
opportunity
estrategias
they provide to
entre las
exchange
diversas instituciones
approaches and
miembros de
strategies
los
among
países
the
de
different
América
member
que forman
institutions
parte de la
and
Conferencia
the American
Interamericana de Seguridad
countries
Social.
that belong to the
A
Inter-American
través de estos
Conference of Social
intercambios
Security.
podemos
Through
aprender
these
unos de
exchanges,
otros y mejorar
we will be able to
nuestras
learn
prácticas,
from each
buscando
other
siempre
and improve
sistemas de
our
seguridad social
practices,
más
always
eficientes
seeking
y
more
sostenibles.
efficient social security
En particular,
systems.
en este encuentro, es un espacio de
Especially in
diálogo y
this CS
reflexión
session,
sobre
which
las
is a
experiencias
space
de
for
Uruguay,
dialogue and
Argentina y Costa Rica
reflection, we
en
will
el
comment on the
establecimiento de sistemas
experiences
de
of Uruguay,
protección total a
Argentina,
la
and
vejez,
Costa Rica in
una medida
establishing
esencial
global old
para
age
atender las
protection
necesidades de
systems,
las personas
an
mayores
essential
y
measure to
cerrar las
meet the
brechas
needs of the
existentes en
elderly
materia de
and
seguridad
close the
social.
existing gaps in their
Estamos aquí para
protection.
discutir un tema de la mayor
We
relevancia,
are here to
la
discuss a
protección de la
relevant
población
topic,
mayor
which is the
en un
protection of the
contexto de
elderly
envejecimiento
population
demográfico.
in a context
En
of
las últimas
demographic
décadas,
aging.
la población de adultos
In
mayores ha
recent
crecido de
decades,
manera
the
significativa en
elderly
nuestra región,
population has grown
lo que plantea
significantly in
nuevos
our
desafíos
region,
para los sistemas de
which
seguridad social.
possess new challenges for social
Es
security
imperativo
systems.
desarrollar estrategias
Therefore, it is crucial
eficientes
to develop
que
effective
garanticen
strategies
la
that guarantee
autonomía,
the
la dignidad
autonomy,
y la
dignity,
participación activa
and
de las
the
personas
active
mayores,
participation of the
asegurando así una
elderly,
vejez plena y
thus
digna.
ensuring a full and
El
dignified old
acelerado
age.
proceso de envejecimiento poblacional
The accelerated
representa un gran
process of
desafío
population
y al
aging
mismo tiempo una
represents a
oportunidad
great challenge
para
and at the
diseñar y
same time an
construir
opportunity
el marco
to design
institucional y las
and build the
políticas
institutional
públicas
framework
que
and public
conduzcan a una
policies
mejor
that will
futuro
lead
para
to a
quienes han
better
contribuido a lo
future
largo de
to
sus
those
vidas
who
al
have
desarrollo de nuestros
contributed
países.
throughout the lives of the development of our
El
countries.
derecho a la protección de las personas
The
mayores,
right to protection of the
reconociendo
elderly,
por los
which is
ordenamientos jurídicos
recognized by the
internacionales,
international
debe ser
legal
objeto de
systems,
desarrollo y profundización a
must be
nivel
developed and
nacional.
addressed
Una
nationally as
atención
well.
integral a la vejez
A global
debería
protection
entenderse
for the
como
elderly
aquella que le
should be
garantice a las personas
understood
mayores
as that
el
which
respeto a sus
guarantees
derechos
respect for
para
the
vivir con
rights to
dignidad,
live with
independencia
dignity,
y autonomía,
independence,
para
and
que puedan
autonomy,
transitar su vejez
so
con la
that
mayor
they
calidad de
can
vida
live their old
posible.
age with the highest
Incluirá
possible
una
quality
serie de
of life.
elementos de servicios y
It will
prestaciones
include a
para
series
el
of elements,
desarrollo de las personas
services, and
mayores
benefits for the
que comprendan
development
la
of the
seguridad
elderly,
económica, la
including
libertad de
economic
trabajar,
security,
la
freedom to
educación para
work,
toda la vida,
lifelong
el
education,
desarrollo de
and
habilidades, el cuidado de
the
la
skills
salud y el bienestar,
development,
así
healthcare,
como la
and
creación
well-being,
de
as
entornos
well as the
propicios y
creation of
favorables
favorable and
adecuados a sus
supportive
necesidades
environments
físicas,
to their
mentales,
physical
que
and
permitan
mental
una
needs
vida plena.
that will allow them to live a full life. Of course, this requires a transformation of society, which implies a change in the perception, treatment, and recognition of the elderly. As noted by leading gerontology specialist Dr. Robert Butler, ageism is one of the greatest obstacles to a dignified and fulfilling old age. True social transformation begins when we recognize and value the role of the elderly in our communities. Ageism refers to the stereotyping, prejudice, and discrimination against individuals or groups because of their age. It includes the creation and perpetuation of negative stereotypes about older adults, continuing of beliefs or feelings about them, and the unfair treatment they receive. To effectively tackle ageism, we must address these harmful attitudes by promoting positive generational interactions and ensuring that policies are inclusive and support the dignity, autonomy, and active participation of the elderly population. This requires not only changes in policies, but also a cultural shift in the way we view and treat the aging population. Each of the countries represented here provides a unique approach, but all share a common goal of ensuring a dignified, independent, and fulfilling life for older people. I'm confident that your contributions will provide us with a deeper understanding of the current situation. This will help us identify existing gaps and challenges. And most importantly, this will inspire us to develop more effective and sustainable strategies. I invite you all to participate in this dialogue and contribute actively with your questions and comments and leverage this opportunity to learn and grow together. Please, during the presentations, send your questions on the chat. Without further ado, and to begin the exchange of ideas and experiences, it is my pleasure to introduce our first panelist, Ms. Yolanda Benavides Murillo, Executive Director of the National Council of Aging in Costa Rica. Ms. Benavides is a Costa Rican geographer and gerontologist from the University of Costa Rica, a specialist in dementia from the Santa Paula University and intervention of dementia in the Alzheimer's. Member of the Comprehensive Assistance for the Elderly Association from Alajuela, and she has worked a lot with the formal and informal caregivers work and has thought, and also she has a work in a gerontology program in University of Costa Rica. She also has taught the course Assistance for the Elderly Institution Management of the Gerontology Postgraduate Program of the University of Costa Rica. She is currently the Executive Director for the Elderly and also for the Costa Rican Elderly Age Institution. Thank you very much, Ms. Benavides, for your participation. I will pass the floor for you. Thank you very much.
Muy buenos días a todos.
Thank you very much. Good morning, everyone. I want to thank, on behalf of the Costa Rican Elderly Institutions, for the Inter-American Center for Social Security Studies for your invitation. And it's an honor for us to participate in this meeting. Welcome, everyone. And I also welcome all the rest of participants and all the rest of the users here. So in this moment, I would like to share with you my presentation. So actually, something that was very good for our country in the elderly field, because in October of the last year, it was the National Police for the Aging and the Old Age was established in 2023-2030. And the National Council for the Elderly, CONAPAM, in terms of the elderly policy based on the mandate 73,
Antes de comenzar en una
2021.
diapositiva, les comparto que la ley
And before we
7935 es
can
la
just
ley
go to the next slide, I would like to
que,
mention that the law
la ley
25
más importante que
is
está
the
aprobada
most
por mayoría en
important
nuestro
law
país,
on the
que es la que
elderly
formula y
population
crea el Consejo
field
Nacional de la
because
Persona Adulta
this
Mayor
creates
y
different
es
councils for the elderly
la,
population.
la responsable de la formulación de
And this is
políticas
the
y planes
responsible for
nacionales
the
en materia
creation
de
for different
envejecimiento,
national programs in terms of old
creada
age.
en
And this was
1999,
created in
que hace una sigla
1999.
Consejo Nacional
And
de la
also,
Persona
this
Adulta
has to
Mayor
do
como ente
with
rector
the
en
National
materia de
Council for the Elderly,
envejecimiento.
CONAPAM
Dentro de su
Institute, as
mandato, este órgano
responsible
ha
for
impulsado
this
la formulación de esta política
work.
nacional
And actually,
para la
this
década
this body has
2023-2023
established the
con el proyecto de dotar al país de un
2023-2022
instrumento que guíe la acción pública
law
frente a los
by
retos que
providing an
plantea el
instrument
acelerado
of the
proceso de
population
envejecimiento de
that
nuestra
established the
población y que
accelerated
le permitirá avanzar
growing
en
of
el cumplimiento de los
population, old
derechos humanos de las
population in
personas
our
adultas
country, and
mayores
also just
durante esta
to
década.
face
Esta
the rights for
política
the
tiene
older
como un
people in this
antecedente
decade.
la Política
And
Nacional de
this
Envejecimiento y
policy
Vejez,
has as a
que tuvo el país para
previous
la década
license for the
2011-2021 y que
decade of
se va a exportar la
2011
diapositiva que le ha
2021.
permitido
And
avanzar
also,
en
this
una
has
acción
allowed us to
institucional y
continue
pública
working
para la atención de las
institutionally
personas
and
adultas
publicly
mayores
for the
ahora con
attention
la
for the
nueva
older
política
person with a new policy for
2023-2033 y se ha
2023 and
propuesto avanzar
2033.
un paso
And we
más
have
al
the purpose
respecto de
just to
este
continue
instrumento,
working in respect to this
a diferencia
instrument,
del anterior, con la formulación de un plan de
because we
acción que
want to
permite
formulate a action
operacionalizar
plan that allow us
las
to make
definiciones
different
estratégicas y los
operations
enfoques
in
de los
addressing the
contenidos de
different
esta política.
strategies according to
Entonces,
the
como
content of this
lo
policy.
muestra la diapositiva, ¿verdad?
So as you
Tenemos
may see here in
un
this slide,
precedente
we
que fue la
have
primera
a
política
history,
que
a
tuvimos en la
precedent as
década
the first policy
del
from the
2011 al
decade
2021. Entonces,
2011-2021.
en el 2021,
So in
ya cuando esta
2021,
política estaba
when this
llegando, esta
policy
primera política
started,
estaba llegando a su fin, se
started
comenzó
or
a
was
trabajar
just
con
concluded,
apoyo
we
del
started
Fondo de
working
Población de las
with the
Naciones
support
Unidas
by
en
the
la
United
elaboración de
Nations
esta
Fund
nueva
support
política que íbamos
for the
a tener
elaboration
para el
of
año
this new
2023.
policy for the
Entonces,
2023.
gracias al apoyo de
So
la
thank
UNFA,
you to the support of
se
UNFA.
reelaboró y se atendieron
We
observaciones técnicas.
redo
Primero se
and
hizo una
we
consulta a la
provide
población
technical
adulta mayor en
observations for
2021
the
y a las
different evaluation for
instituciones
2021
se
elderly
realizó
people.
una encuesta
And for
nacional
the
y en el año
following
21 se
years,
elaboró un
we
primer
create
borrador.
a national
Después,
survey.
ya para febrero o
And this
marzo
was
del año
created a brief
22 se
survey.
reelaboró y
Now, in
dependientes de las
2022, it
observaciones
was
se definieron
redo, and
acciones y
actually we addressed
responsables
the
a nivel de
different
las
actions and we
instituciones
provide the
y se
different
preparan
responsible
este
people in the
borrador
different
final para la
institutions.
consulta.
And then we
Se hizo
create a
base en las
final draft
observaciones
of these
recibidas en la consulta
consultations.
pública y
And
respuesta
actually,
y se
we
elaboró el plan de
create
acción
the action
con metas
plan
concretas anuales
based
con
on
una
concrete
base de
annual
indicadores. Y esto
goals
ya
based on
para el mes de
indicators
abril y
line
agosto del año
for the
2023,
April and
de la
August
mano del Consejo
2023
Nacional de la
year,
Persona Adulta Mayor con
supported by
los
the
proyectos
National
de ayuda
Council for
social
the
y
Elderly,
ente rector
CONAPAM,
en programas
and
de
the
población
VITA
en
was
pobreza
the
con apoyo
responsible in
del
terms
Banco
for the
Interamericano de
poverty,
Desarrollo.
and also by the support by the Inter-American Bank of
Entonces, como
Development.
primero, aquí ya paso a paso, toda
So
una
first of all,
revisión
we will see
documental,
here
¿verdad? De todos los
each of the
marcos
steps in which we
nos
develop
regulan
each of
y que tienen
these
que ver con las personas
frameworks,
adultas
and it has
mayores.
to do with
Se
the
estableció
older
un mecanismo
people.
de
First
coordinación
of all, we
con
establish a
contrapartes,
coordination
se sistematizaron las
mechanism.
observaciones
Then
de la
we
consulta tanto públicas y
systematize the
respuestas, la
observations,
negociación
and
con
then we provide it with
instituciones
the consultation for
ejecutoras
the
para
public
ratificar
users.
compromisos, ¿verdad? Porque
And also we
recordemos que
have
esta
some
política
negotiations for
involucra a
different
todas las instituciones
institutions just to
estatales que atienden
ratify
¿verdad?
the
de forma bastante
commitment and just
directa
to
y
concrete
directamente a la
different
población
goals,
adulta mayor
because you all know that this
para
is
que
provided
realmente
for the old
hubieran
people.
compromisos por
Of
parte de
course,
estas
just to
instituciones para
have
alcanzar las metas
commitment
propuestas en este plan.
by these
La
enterprises or
integración y
companies
el
just to
resultado
provide or just
mediado
to
con
continue working
instituciones y
with
las
the
observaciones
previous
sobre la consulta del
policies.
plan de acción.
And then we
Se llevó a la
integrate
Junta Rectora del
we
Consejo
integrate the
Nacional de la Persona
results
Adulta Mayor
in the
para su
dialogue for the
ratificación
older
y
people
luego
for
pasó
the
al MIDE Plan
ratification, and
para su
then we
análisis
have to
y
go to the
observaciones. La
MIDE plan for
presentación,
the
ya una vez
observations.
revisado por el MIDE
And
Plan,
once
se
we already
realizaron las
have reviewed
revisiones
this by
finales y
MIDE plan, we
documentales y
provide
demás
the
y
final
lista
observations
sigue
and the
nuestra
final
política
documentation, and then we conclude with our policy.
Con respecto a la consulta
Now,
pública,
in terms of the public
esta
consultation,
política se consultaron los objetivos
in
o
this
se plantearon
policy,
estos
we
5
address
ejes
the
que fueron
different
los que la
objectives,
misma
and actually
población
we
adulta
address
mayor
these five
consideraba que eran
axes
relevantes
that
para
in
ellos,
which
¿verdad?
were considered very
Se
relevant for
realizó
them.
una formulación virtual
And
mediante un
we made
formulario
a
interactivo, se
virtual
recibieron las
formulation of
369 observaciones diferentes
documentation
provenientes de
based on
40 personas y organizaciones
769
con estos
observations, different
porcentajes en
observations,
donde hubo aportes y
in which
observaciones a
percentage
los
we
5
provide
ejes de seguridad
different
económica en la vejez, buen
different approaches for the security, economical security for the other people, for the health care and care, the human development, and then the institutionality.
Esta es una muestra, por ejemplo, de una de
Okay,
las
so for
observaciones
example, this
realizadas
is one of the
cada día por
examples of all
diferentes
the
profesionales o
observations
personas que
by
hacían su
different
observación,
people or
al menos
professionals
en
that
este
provide us
caso de
with
ejemplo,
their
para el eje de seguridad
insights.
económica en la
So
vez
this
pasada.
one, the first one was for the social security, economical social security for the
El
older
contenido, como
people.
decía, la política tiene un primer
And now
capítulo
the
de
content for
antecedentes, un
this
marco
policy
normativo,
has a
criterios y enfoques,
background,
estudio de
a
situación,
standard
diagnósticos y
or a
desafíos, ejes,
standardization
objetivos
framework,
y
the
estrategias
principles,
específicas, modelo de gestión y
approaches,
consideraciones
state
finales.
of the art, access, objectives, the management
En
model,
nuestra
and
política
final
versa sobre
considerations.
principios como la
And our policy
seguridad,
is based on
de
different
universidad,
principles
igualdad de
in which we
oportunidades, no
include
discriminación, acción
universality,
positiva,
equality of
corresponsabilidad
opportunities
social
and
e intergeneracional,
non-discrimination, positive
participación
action,
social, independencia y autonomía.
co-responsibility for social intergenerational
Los
social
enfoques,
correspondence,
enfoque de
social
derechos humanos,
participation,
curso de
and
vida,
dependency.
equidad e
And
igualdad de
also
género,
within the
gestión de
scopes, we included
resultados,
the human rights, their
interseccionalidad e
life course,
interculturalidad y
equality,
atención
gender
centrada en la persona.
equality, management of resource, and
Los ejes
attention
de
based on
intervención y
people.
objetivos de esta política,
Now, the
de
axis of the
nuestra política
intervention
nacional
and
de envejecimiento
objectives of this
y
national
se
policy
articulan en
for
5 ejes
aging on
que
old
responden a
age
los núcleos de
includes
problemas
different
identificados y
5
mencionados en
axes that
estos,
will answer the
fueron
different
sacados de la consulta a las
scopes
personas
or
adultas mayores
problems
en unión con las
identified in
instituciones, y estos
making
ejes
the
son los
diagnostic for
siguientes:
the different situations.
seguridad económica en
And
la
this
vejez,
includes as
welfare para la
follows:
vejez y vida
the
libre de vejez,
economical
atención
safety
integral,
on
salud y
the old
cuidados,
age,
desarrollo humano y
the good
fortalecimiento de la
treatment or good
institucionalidad.
care for the old age, the human development,
Dijimos
and
que si el eje de
strengthen of the
economía y vejez, el objetivo
institutions.
era fortalecer la seguridad
Now, in
económica de las
terms of
personas
the
adultas mayores
axis, number
mediante
one
la
for the
protección del
economical
derecho al
social
trabajo
security for the
de aquellas
old
personas que
age, the main
voluntariamente deseen
objective is that
continuar
just to
su
strengthen the
trayectoria
economical
laboral, el derecho
safety
a las
on
actividades
the old
productivas, la
age
productividad sin
people
discriminación,
through the
situaciones de
protection of the
vulnerabilidad y
human
derecho
right
social.
to the decent work and
En
those
este
people
eje
that
hablamos entonces del
voluntary
empleo de aquellas personas,
wants
como decía, que
to
quisieran
continue
seguir laborando
working
desde el
in their
Ministerio de Trabajo y
environment, of
Seguridad
course.
Social. Se
And
creó un
this is
código
based on the
específicamente
Ministry of
para
Social
personas que
Security.
deseen
We
seguir
create a
trabajando después
code
de los
for old people
65
that want
años
to continue
de
working
edad.
after the
Por lo
65
general,
years.
esas personas en Costa Rica se
Because
pensionan
of course
en
we
competencias productivas y de gestión de
we want
emprendimiento,
people
seguridad
that
social
they're
y
going to be
acceso a
retired at
programas de
that age.
protección social.
However, this is a social protection program
El eje
established
2
already by
trata el
this
buen trato en la
policy.
vejez libre de
Now,
violencia,
the
fortalecer
axis
las
number
condiciones
two is a
institucionales,
good
sociales,
treatment
culturales y
for the old
personales para el
people
disfrute de una
and
vida
just
plena
to
sin
be free
violencia
of
y buen
violence.
trato en la vejez.
And
Aquí
just
hablamos
to
de
have a
hacer
good
campañas
care
fuertes de
within their
conciencia y
old age. In this
de
case, we want just
sensibilización para
to
evitar
continue working
que
with
los adultos mayores sean
sensibilization
violentados, porque sabemos que
systems to
sus mayores
avoid
agresores
older
no
people to
están
be
están en el núcleo
violated.
familiar porque desconocen las
Because most
responsabilidades
of
como
people
familia,
that are
tienen
within their
que
families,
no
they don't
solamente
know or
cuidar
they
y proteger,
don't
sino
have any
implementar los
knowledge that
derechos,
they have
atención a las
rights.
violencias
And of course,
comunicaciones,
I won't
acceso a
be able
justicia y
just to
atención
address the different
psicosocial.
violence. And of course, in this case, we have to take care of their
Atención integral en salud
psychological
y
attention
cuidados,
or just to
procurar
provide just this
este eje.
access for the
Su
attention.
objetivo es procurar el bienestar físico, mental y social de las
Now,
personas
axis
adultas mayores
number three
mediante la
has to do with
prevención
the
y la mejora de
comprehensive
la calidad de los
attention and
servicios
healthcare
sociosanitarios,
and care.
favoreciendo un envejecimiento
And
activo
this
y
will be
saludable, así
promote
como disponer de un
a
sistema
safety and health
fortalecido de cuidados
environment and
apoyado
strengthen
de
the
apoyo para
care
la atención de la
that will be
dependencia.
supported
Recordemos que
for
Costa
the
Rica tiene una ley
dependency for the
bastante
old
reciente que se
people.
llama la ley
Just
SICA,
let's
que
remember
enfoca
that
también los
Costa Rica
cuidados en
has a
población
CICA
adulta mayor
law
ya con
that
grados
is
altos de
address
dependencia, y
old
también,
people
gracias a Dios,
with a
está
high level of
bien amarrado a la
dependency.
figura del
And of
cuidador como
course,
una figura
they have
importante en el
to
cuidado de estas
consider the
personas adultas mayores con
caregiver as an
dependencia.
important role for those
Este
people
eje
that need this care.
visualiza
And also,
la
this
parte de salud
visualize
integral, no
the
solamente desde la parte
comprehensive
curativa, sino
care, not only
preventiva,
for
con
the
modelos de estilos de vida
preventive
saludables desde
point of
edades
view,
tempranas,
but also just to
cuidado
provide
autocuidado, atención
healthcare
prioritaria
systems
de
and
trato
just to
preferencial y respetuoso
prioritize
de los derechos, incluyendo el
to prioritize
consentimiento
the
libre e
care
informado,
with the
la formación e
free
investigación en
will of
las
the
ciencias de
elder
salud,
people.
la prevención y
And also,
promoción de
we
la
have
salud, la
established the
atención de
prevention
enfermedades,
and promotion
rehabilitación y
of
cuidados
health and the
paliativos, y
attention for the
establece los
different
lineamientos generales
diseases,
de tratamientos en
rehabilitation
nuestro
and
país,
palliative
y
care.
la atención especializada
And the
en los diferentes
specialized
niveles de salud
attention
de
in the
nuestro
different
país.
levels
El eje
of
4,
healthcare in our country. Now,
desarrollo humano
axis
en la
number
vejez, es
4,
un
which is
objetivo, como
the
yo,
human development in the
de
old
finalidad
age. which objective is just to enhance the development of the older people potential to be integrated within the society. So in this objective also we include the improvement and the leverage of the infrastructure and just to create better, sustainable and inclusive public spaces for them. And almost 50% of other people are integrated to these systems to make more accessibility for transportation and a household for the older people. I'm sorry because I'm going very quick, but I have to show you some images because, of course, we have to tackle and just to support our all elderly people. Okay, now let's go ahead. Let's continue with access number 5. This is the strengthening of the institutionality for the promotion and protection for the human rights of elder people. And the objective is just to strengthen the institutionality linked to the protection and promotion of the human rights for the elderly. And also we want just to improve the coordination and articulation between the institutions. In most of the times, in a country level, it's very difficult just to have this interrelationship between the different situations. And the other objective is just the consolidation of spaces that will represent all the elderly people, and also to strengthen a organism or body just to generate or systematize some more information and data. Now, in this chart, you will see as a strategic objective the action, the indicator, the term, people, and the responsible people. So within our policy, address different important aspects because this covers the objectives, the actions, the indicators, the dates in which they should be addressed, and the most important thing that you should have already heard is the name of the institution that should be done on time. And I'm sorry for the expression, but we have to just to continue to take action quickly because this will allow us to continue working every year and just to make better decisions. So because we have just to refer to a ministry or to a council or just to address certain things that are not running correctly, because the greatest unions or the people that will receive our benefits will be the elderly people. Okay, now this has to do with the previous policy, the first one from 2011 and the 2021 for action plan and evaluation. However, for the policy from 2023 and 2033, its action plan is to evaluate these management indicators every 15 years. And also you can see here the 5 axes, automatic access, and the strengthening for the application for the models, and the action plans to strengthen and improvement the nationals, which has to do with the previous instruments. As you may see here, we are currently working on the consultative board. And this comprises adult people. Actually, the past June, we have a meeting in Costa Rica and includes the 4 principal locations with Alajuela, Cartago. And we were able just to gather 50 other people that participated in the access and how they will be the people that will measure every 3 months the base of each of the axes. So what we realize here is that not all people integrated in this number were included, or because we weren't able just to evaluate them from each of the locations from the Caribbean or some other locations in Latin America. So the main objective here is that the great majority or the great number of population in Costa Rica can participate and be part of the new concentrations to continue working with a consultative board based on the participation of elderly people. Continue next slide. Okay, now the follow-up system and evaluation has a cycle process, and this includes the gathering of information, the following for the reports, We start the evaluation. Because we received the following report, we continue with the evaluation. All the elderly people participated with a complementary research in case it is necessary. Then we continue with the evaluation for the report, and they will provide us with different corrective and judgment measures to just to continue working with the execution. Now, in this table, you can see all the institutions involved within the interinstitutional relationship, which is the Judicial Union, CONABDIS, the Costa Rican Social Security Fund, etc. So you can just read them all together here. And also we included the different institutional national universities. So all these institutions comprise the actors of the institutions that committed with us on the execution and preparation of our policy. So they have a commitment with us. Okay, so I would like, could you please just show us the last image that I sent you? I'm sorry if I was talking a lot quick because I think that I'm missing some more minutes. So please give me just a few minutes. And let me just share with you some other charts so you can just understand better. Please let me know if you can see it now. Yeah, we can see it. Actually, it was executed in the last June, and we were able just to gather 50 other people to provide them the space so they can provide us with their claims or their insights, and also just to create these groups. This was held in Arabia Hotel, and we received all elderly people, and this was covered by the publicity members. And we followed the protocols. We provide them with a breakfast and some other food. And Elder Belroman was the one that was responsible and actually who was introducing this massive event. And our budget allowed us to gather more than 50 elderly people, and we were presented them with the law, and also we continue working in the tables in which they manifested their insights, their claims, and the way they will be developing this work. And actually they were working with different officials. So this was an open and more democratic space because they form the different commissions according to the access. And then we will continue working with us on the compliance of this policy. So this was an awesome experience. And in the first image to the left, there was elderly people providing us their insights in front of the National Council for the Elderly, CONAPAM, and also this was exposed by an elderly person. So this policy, by the creation of this policy, was awesome. We want them to open this space for them because they are our main actors, their main characters. Because of course, this policy, if this policy doesn't cover elderly people as promoters, as unions or representatives, of course, we cannot continue working on this. We have a clear thing that, of course, we have to continue working in Costa Rica for the policy can have an action plan in which the elderly person is the main actor or the main character. Thank you very much. Thank you very much for your intervention. It was very interesting. And this insight of what has been the process in Costa Rica for the national policy and how you have been working within the institutions, because you have a great progress in that. So I'm really pleased just to see that how this progress is being rolling out, because every time the older persons have a great role within the public policies. And which is most important is the participation and evaluation of the institutions, because they should be committed with this process. And also because the countries should continue working to provide the participation in the ones that should evaluate the national efforts and institutional efforts as well that are addressed towards this population. Thank you very much for your participation, Ms. Yolanda. And before we continue, I would like to say hello to Mr. Daniel Grafiña, who is already here with us. Thank you very much for joining us now. And now we will continue with Ms. Mónica Roque. Ms. Mónica Roque comes from Argentina. He is honorary president of the Latin America Association of Community Gerontology. She is doctor specialized in public policies or politics focused on human rights, magister in healthcare and social security administration with a specialty in the elderly, and magister in social security systems administration of the University of Alcalá, Spain. And also, she's former Secretary General of Human Rights, Community Gerontology, Gender as an Assistance Policies at the National Institute of Social Services for Retirees and Pensioners, and a consultant of the international institutions and lecturer from CIESS. And also she has been a secretary for the Social Security for the pensioners and retirees from 2010 to 2023. And for 14 years, she has established different policies for all the members of the development of the nation and member of the drafting committee for the older person. And also, she is a former president for the Inter-American Convention on the Rights of Older Persons and representative Argentine representative for the defense of the human rights for the elder people. She has also been a lecturer for international national institutions, and she has held different international research. Thank you very much, Ms. Mónica, for your participation, and I will pass the floor for you. Thank you very much, Mr. Emilio. Thank you very much for this invitation. And Adriana, for all your support, and all your staff in the CIESS is great. Thank you very much for all your support, because you are giving us a lot of support. And also, I want just to congratulate Yolanda, because you have a great role within the public policies, because if you call about the convention, you should consider the public policies. It means that Costa Rica and Uruguay are the main countries, along with Argentina and Chile, on the creation of this convention. And actually, with these countries, we were together, and actually we tried to tackle with the convention. So I think that your planification or your planning is excellent, because even though many countries have planned many policies for the elderly people, and of course, like considering all the older people, it's awesome. So I will just provide you with a summary with my presentation, and I will share my screen with you. And I will talk about a policy that we have been working on in the last years. And I will be working with, I haven't been a director for the International Convention, Latin American Convention for the Elderly People. So I was working in both the government with the minister that managed the Social Security. So these are two different areas in my country. So now the convention, I was told you, it was created due to different years and due to the different fighting within the different countries. And this was a work that was supported by the INOEA that will be able to protect the human rights of all elderly people, because not other people want the right for this. And of course, there are some other countries that have this ratification, such as Costa Rica, Uruguay. And I think that Colombia already have this ratification of this convention, which is being considered a law. Now, first of all, this convention determines different protection standards, specific standards. And this is very important just to think about the public policy. So within all elderly people groups, all people over 65 years, except Costa Rica, because at the end of the day, Costa Rica has already told us that they have already ratified the law to 65, but most of the other members from other countries were able just to be retired for the 65. And also, this convention established the prohibition of discrimination based on the oath of ageism of the people. And also, this convention provides three new articles, which is Article number 6, that establishes the right of life and dignity to the older people, and Article number 7, the right for the independence and autonomy, and Article 12, which is the right for the care given to the long term for the older people. And of course, the aging, the ageism is not a problem. And the old age is not a problem. However, we should address the old age and all the issues on the old age from the human rights perspectives that acknowledge the valuable contributions of the old age population for the cultural or diversity of their communities, the human development, social development, economical development, and the eradication of the poverty. And this is very important because most of the people tell us that the old age is an expense. However, there are some other insights here. So many years ago, we have already established the gold economy. So you might hear about this previously. And this kind of economy is a part of the global economy linked to the demographic change due to the old age or aging of the population that is focusing on the needs and demands of the old people. And also, with this, we can generate new jobs, and the aging fights against unemployment. So we should see and the aging as a challenge or as a thing that the humanity has already got. And due to this kind of economy, we can say that in Europe, for instance, this kind of economy has mobilized more than 3.7 billion people in 2015. Now, in 2030, this will move more than 3.7 billion of euros. And actually, Latin America is not the most poor country. However, the total consumption will be part from the people over 65 years old. So, for instance, in this chart, you can see here the consumption. Who can consume in the West Europe? So, the middle of the consumption comes from the people over 65 years. So, of course, this moves the economy. In something that I would like to mention also, as Yolanda previously stated, is the action plan, because this has to be based on the human rights. So him, in a report, has established that the number of the business or the entrepreneurship people surpasses over young people of around 18 and 29 years old. So we can see here that entrepreneur people, or around the age of the entrepreneur people, is around 61 years old. So from the economy, we provide different employment for the different generations. So of course, we can say that the aging, it is not all people that are already are only in their houses, or those people that are only doing nothing, but these older people is the ones that keep growing the economy. And also, this is also similar in the United Kingdom because all the expenses based on the healthcare, social security by the old elderly people has been very useful. And we have calculated that the elder people in United Kingdom expended more than 45 million. And in this sense, we can mention that the elderly people provides more than 76 million. So when you ask me, where can we get all this money from this economy? Of course, this comes from the elderly progress because we generate employment, we move the economy. Therefore, of course, we can say that we have a difficulty to receive care or just to continue working autonomously. We should receive our money back and the money back that we have provided for the society. And then I would like to highlight on article number 5 that has to do with equality and non-discrimination due to the age. Because we might think that when we get older, we cannot contribute to the society or because we get more poor and we are discriminated by those instances. However, you may know that Yuso has a penalty in Spain because they live, they just make more than 7,291 people passed away due to their age. So what is happening here with the elderly people is that, of course, we have a great gap between the generations. However, we're actually providing many things and many resources from many perspectives. And of course, this article mentioned that prohibits the discrimination or inequality due to gender equality or gender identity. And this is because more than 65 countries in the world punish people due to their sexual orientation, or because all older women that are part from the LGBT community are punished. So in this case, we can say that in the Convention for the Elderly People, we are talking about people with older people. So of course, we cannot provide this in a more male way because we are just leaving women aside. So in this case, we try to talk about older people when we talk about on young people. So when we talk about older people, we should include both genders, male and female. This also has to do that people are subject, or we are subject of rights. So when we talk about people or persons, are those human people that has the rights for the human rights. So the right for the life, the aging rights has to do with the new standards, and also this also has to do with the euthanasia, because in the world there are more than 40% of people that need palliative care, and this covers population over 70 years old. So now if we consider certain statistics, the 80% of old people that need palliative medication, treatment, etc., don't receive it. So this is very important because according to the convention, we should consider it. And also, the right for the lack of autonomy produces discrimination due to the age and the lack of autonomy, because autonomy is a capacity that old people have to decide over our own life without independency or dependency. And the contrary of autonomy is the heteronomy. And this is very important because the convention should be considered and promoted based on the autonomy of people, that we can decide what to do with our own life. And also the right for the participation that was already established and provided by Yolanda. Now we have the right to safety and just to have a life free of violence. And for the first time, we work in a program that not only address the different topics of the abuse and violence, because we not only has to consider the violence, but we should prevent it. And how we can prevent it? By the promotion of the good treatment or well treatment. Now, the informed will has to do with this because, of course, we have improved the numbers of the people that will to sign the free will. And most of them are signed by the family members or the physicians, and this is not signed by the elderly people. And of course, this should be also addressed by the convention. Now, the right to receive health care in the long term. So let's see that the countries that has the highest rate for the institutionalization for the aging has more than the 65%. So it means that there's a 95% of people that live in a healthcare residence. So what are the programs that should be developed globally and internationally? Or just to provide different programs for the community. And of course, there are a less development for the assistants or for the household people that can just share their household together. So actually, we can keep growing on this. So this is our main objective in the future. And when we talk about residences, we have to talk about the long-term residences based on the human rights. And also just to mention that should be promote the well treatment or good treatment. Either they live in their house or in a residency, and also just to promote the dignity in the old age and the perspective of the gender and the sexual diversity, and also to continue working on the quality of services or all the promotion of the professional training and the right of privacy or intimacy, because we don't have just to gather together more than 3 people together in a residency, because of course this is considered a violence. So of course, in each of the residences rooms has a capacity of 4, 5 or more people. However, here in our institution, we prohibit it. And these residences should be free of independency. And also the right to social security is very important. And also we have, we as women, we have the possibility to access to the different tools, because we tend to take care of people in our household because the work or women are mostly informal. So therefore, a policy that was applied in Uruguay, and I don't know if this was already applicable in other countries, we should consider that for each children, we should establish a promotion for the care. So the provisional system acknowledged this in this case. Now, the right to health, of course, this is a human right. However, I would like to emphasize of the free medication, because WHO mentioned that this should be accessible for the elderly population, and just to promote different public policies on the sexual health and reproductive health. And what am I just highlighting this in the reproductive process? Because the discrimination on this group is that the HIV increases, and this increase in women instead of men. And actually, this is not measurable. However, old people, or even though we can consider that the elder people don't have sexual relationships, this also is translated into a higher rate on the sexual diseases.
Del PBI en los sistemas de salud. Esto no sucede en la mayoría de los países
and we have here a greater percentage of the expenditure of the countries, because of course for all the healthcare expenses should be covered by the own population. And actually, nowadays, we have more than 500,000 million of people that are living in poverty. And also in PAMI, we have another system which is free medication provided by people that is member from the PAMI. And also we have the right to household because all people that have a house, of course, they don't have to go to the residency. So all people that need to go to the residency, they will need a severe need. So in this case, we should build houses. So where can we take the money from? Of course, it depends of our contribution. So according to our experience from PAMI perspective, this is what we did, in which we continue building collaborative houses with common spaces. And actually, we build small houses with common spaces with a center for fun, in which they can just develop their cognitive skills for the older people. And also for the access to justice. So if I say that the convention is based on the public policy, I have to acknowledge this. And this should be addressed due to the justice, to be trustful, and of course we have to guarantee the life of elderly people. Now the awareness in this case, and the awareness is very important, very crucial in terms of the elderly people, because we should continue working on the promotion of the autonomy and working on the convention, because sometimes it's very difficult to tackle or just to fight against the human rights because we don't have enough knowledge. Now, a follow-up mechanism is very important because, of course, it's urgent just to continue working on a follow-up mechanisms within the organizations in Latin America and the Caribbean. Thank you very much. I'm sorry if I just take some more minutes, but thank you very much for this space. Thank you very much, Ms. Roque. I think that you have already presented a lot of interesting information that it's very important for us. And I would like to highlight certain things that you have already mentioned within or during your presentation. First of all, the convention established minimum standards, and this is very important to understand because all committed countries on the ratification of the convention has one point in common. Of course, this is not a point towards the destination, but this is a starting point. And something that is important for me, that the aging is not a problem. And also we should understand the aging from a point of view of human rights, because the aging doesn't constitute an expenditure. However, as you previously mentioned, aging for the protection for elderly people is an opportunity for our societies. So the economical dynamic that is produced by the elderly people, not only in terms of expenditure, but also in terms of movement of the economies. So I think that this is an important point to continue having a different vision of what is the main role of the elderly people in our societies. So actually we can see this in a more developed countries that take actions in this regard. And there is another phrase that I really liked, which is that the aging is a goal from the society. Because of course, we cannot understand this as this challenge or non-challenge here, because of course we can provide a human rights for the people that concluded their productive stage. And actually, all productive stages don't consider different ages for prescription, because nowadays, actually, I belong to the old age generation. And actually, many people are in these conditions. We usually contribute to the societies in terms of experience, knowledge, and actually we continue be valuable for the society. And I think that the most important change besides or within all the institutions is to change the culture and generate a new culture within this important topic. And actually, as you mentioned, all those people that affect these kind of groups are the family members. Because, of course, they don't understand the main role of the elderly people. Thank you very much for having this opportunity to listen to your insights. Okay, so now we will pass the floor to Mr. Daniel Grafiña, who is the Vice President of the Social Security Bank. She holds a bachelor's in the International Relations from the University of the Republic of Uruguay, a former member of Uruguay's National Parliament and the Montevideo's Parliament, former consultant of the Director of the National Port Administration, and also he was a member for the Deputy Board from 2005, and from 2020 he belongs to the different National Fuel and Alcohol Administration for Mexico again. Thank you very much, Daniel, for joining us today. We will pass the floor for you now. Hello, good afternoon. Thank you very much, Mr. Emilio, for this invitation. And I'm very happy to have the opportunity to participate in this important meeting. And actually, I will talk now about the main policies based on the elderly person in terms of Social Security. Now, my institution is the main public body in charge of security systems in Uruguay. It was founded in 1967, and this is an autonomous entity of the Uruguayan government, and we have the responsibility to manage the retirement, pension, programs, and some other social benefits that I will be developing during my presentation. So I was mentioning on the main role of the different people, especially as you may know, we have the directory, which is the maximum level organism that is held for more than 7 directors that are called social directors, and each of them represents the pensioners and retirees, and especially for all people that has to do with the electoral body of Uruguay. So in this case, we base on 2 pillars because we consider 2 pillars, which is the economical programs in which we talk about the benefits or survivors pensions and assistance pensions unsubsidized for funeral expenses. And then we have some other programs, which are the social programs, in which we provide support because we address or we provide support for the different areas such as housing, tourism, and access to technology. Now, of course, the coverage of people over 65 people, in each of 95 people has certain kind of coverage. The great majority of them receive the support by the National Social Security Bank. And that covers almost the 91.3%. And the other rest, or the rest of the coverage has to do with the different notary or banking institutions. Now, the types of retirements includes 3 of them. The first one is a common retirement, and this is granted to all people or people around 60 years starting in 2033, and also this has to do with the National Parliament in terms of Social Security. So in 2033, will we continue old people are continue being retired with 65 years old. And then we have another retirement, which is called the old age retirement, and it can be requested at 70 years of age and 15 years of service, and with the possibility of decreasing the age and increasing the years of service until 67 years of age to 21 years of service. Then we have another retirement, which is the retirement due to physical disability. And this is granted to workers who have an absolute and permanent disability or disability for all types of work. So in this case, we should consider what will be the level of the retirement. And other of the economic benefits, as you may see here, is the survivor's pension. So in this case, for all the person that passed away, it is awarded to the relatives for the deceased who depended on him financially. And in Social Security reform, they can also access to the old age pension from the 65 years old if the person shows that he or she has received direct care or unpaid care for either a child or children, parents, grandchildren, and siblings. And of course, they are able to acknowledge these people on around 65 years old. And then from the reform, we established the disability pension, and actually we provide the access to this. And this is awarded to the people with disabilities, and mainly this is established for the north of our country, in which the informality rates are very high. And of course, sometimes the alternative prone us to consider the disability pension. And this is established for or presented for old people that may have any kind of disability or they lack of resources to cover their vital needs. And now for the old age pension, this is something that is called CIESS, and this is when the body pays for different treatments. And this can cover either psychological treatment, or also we can just refer to different workshops in which the person can make certain hand work, or the main objective here is just to enhance or improve their quality of life. And then we have the assistance or old age assistance, because in this case, this is focused on the social development, but when the person is 65 or more than 70 years old, these people are covered by the Social Security Bank. Now, I also was mentioning on the new law in the Uruguayan department, and this is the law number 20 of subsection 130. And within the benefits, actually, we have an additional old age pension. So if these non-contributive benefits for people that are less than 3 years of registration in our institution, of course, they have the authorization or the right to receive this kind of pension. And then we implemented a retirement solidarity supplements. And also, we have some other important aspect here is just to address the active aging through the reform, because we have the possibility to provide the money for people that is already retired, and he or she can continue working. Now we have some programs which is called housing solutions programs. And in all our countries, in Uruguay mainly, the housing complex is distributed into the different departments of our country for the retiree people. However, the most of them are provided for the pensioners or retirees, or for those people that are based on the contributive system. So for this, we hire administrative companies that address the management, the direct management with the beneficiaries. And also we have different officials or social assistants of the organizations that work together with the beneficiaries. And they are able to detect the different circumstances that can be either corrected or not. And then we have the rental subsidy. And this is principally established for critical circumstances, or if a beneficiary is facing severe characteristics or occurrences, or when they are not able to pay a common household or housing, or in case they live in the street. And now, the last January, we have generated a new rental subsidy that is already provided for retirees or survival retirees based on the survival pension. And of course, in this case, this section of this kind of program was lower of the expected rate. So we have created this new rental subsidy, which is different from the one that I have already mentioned previously. And actually, we have provided a lot of departments in housing and for different people in the country. So we try to provide dignified housing for all the population. Now we have the bed capacity. And of course, we should measure their volunteer because in this case, this is provided for the elder people, which is in charge of the BPS. However, of course, we need the free will of the person to make such decision. And also, these kind of programs are distributed around Uruguay. And this is something that we should consider and which is very important. Now, in terms of social tourism programs, we provide vacation stays or social benefits for BPS liabilities who provide stays in its resorts. And we currently have signed a new convention into a state that has a new vacation resort. And this is provided for the beneficiaries in the short term. And also we have another culture and recreation programs in which we develop different activities, courses, and workshops to promote social integration and personal development. Now, Ibirapita program. And the main objective here is just to promote the digital inclusion among the elderly people. Because of course we all know that we lack, or during the ages, we lack different skills. So with this digital inclusion has helped us a lot. And through this program, we have already created different communication networks because the elderly people are able to connect with other family members. And of course, we have provided them with a cell phone by the state so they can continue working this communication. And also they have the right to spend a lot of minutes to talk with certain friends or some other elderly people. And actually we provide them with 20 gigabytes for free so they can access to different websites. And I think that this is one of the many alternatives existing to strengthen the communication networks between the members of the elderly population and their family members. And of course, there are certain beneficiaries that are able to access to a data application and ensure their communication. And also we have prepared or created an application in which all the elderly people can access to different kind of benefits. Of course, by the support by different institutions of the state.
Yo recién les hablaba de prestaciones sociales y lo que significa la
And I
adjudicación.
already have mentioned the social benefits and what is the meaning of the housing allocation and the rentals due to the eviction. And this is something that has created a greater social progress in which we consider the different complications in terms of medical scope, or by the rentals due to eviction, because this is part of the critical circumstances. And also the new rent subsidy this has been created recently. And actually we call the best quotas is when a certain elderly people face medical difficulties. And if the beneficiary decides to be part of these locations, of course, they will be able to do so. And we provide them different economical support. And this is useful for them to cover the expenses or just to make different repairs in these locations. And there are some other institutions in this sense, for example, the public infrastructure or the transportation or the other institutions that are supported by the government. And as I mentioned previously, this is provided when people face difficulties during their life.
También existen beneficios que van dirigidos en actividad.
And also we have some other benefits that are addressed for the different options. So of course, because there are different processes that people have to face during their retirement stage. And these are free. And when they get retired, we support them by providing different loans for different services. And the rates are very, very low. And they are lower than the market rates. And then we have some other kind of loans for pensioners and retirees in our country that live in similar situations. And these rates are lower from the ones in the market.
En lo que tiene que ver con la salud y la atención, la afiliación mutual para jubilados y
Now,
pensionistas
for the
son
mutual
beneficiarios
affiliation or retirees and
del Seguro
pensioners
Nacional de
beneficiaries,
Salud, todos los jubilados
the
deberán
healthcare,
caja militar y
the national
especial,
health care
justamente,
insurance
tanto los jubilados
is
militares como
provided
policiales tienen
for all the
su propio
retirees, with the
hospital,
exception
por eso
of the military
quedan
and
por
police
fuera
fund.
del sistema del Seguro Nacional de Salud.
And the pensioners and beneficiaries of the national health care insurance. Now, in the event that the beneficiaries lose the protection of the national health insurance, this might be due to the loss of passivity or death. Or if they have dependent children or minors, they will be able to maintain health coverage by 12 more months.
Basado fundamentalmente en la composición.
Now, how much is contributed for this concept? This is also contributed by the family or due to the family situation.
verán la variante que hay en el
And
porcentaje.
if this percentage, it depends on the facility to get retired. And of course, if they have a lower rate for the retiree or the retirement, of course, they will receive lower
Por último, para ir
compensation.
finalizando, les quiero comentar algo que ustedes seguramente lo habrán visto en otra oportunidad.
And something I
hablando
would
del
like to
programa de
mention that you
asistentes
might have already
personales,
listened to it is
que es también
previously
una
is the
prestación
personal assistant program,
económica que está
because
destinada
this
a
is
la
a
contratación de
financial
un
benefit
servicio de
intended
asistente
for the
personal
hiring of a
para
personal
colaborar en
assistant
las
service
actividades
to work or
básicas
just to
de
collaborate in the development
que
of the
llevamos
daily
adelante
activities of
conjunto
people with
también
severe
con el
dependency.
Ministerio de Desarrollo
And also
Social,
we
que
have
está
worked with
dirigida
the Ministry of Social
a los menores de
Development,
19 años,
which
pero
is
en este
addressed
caso importa
to
destacar a los
to
mayores de
people
80. Son personas con dependencia
up to
severa
29 years of age of
residiendo,
over
por
80.
supuesto, dentro del
And
territorio
people with severe
nacional.
dependency must reside in their private
Ahí lo
home within the
que
national
en muchas
territory.
circunstancias se puede
And of
apreciar
course,
es beneficiarios, por ejemplo, nuestros que viven en complejos
if there are
de
different
reformas,
beneficiaries that live in difficult locations, or
los puedan
because
ayudar a llevar adelante las tareas.
they need different or depend from others, of course, they can just live under the same roof. They can just get this kind of program. Now we have another subsidy, an access subsidy, that can provide the total subsidy. That actually this is being lowered gradually. And if you have greater income, the subsidy will be lower to pay for all people that should be assisted in a more personal way. So from to 12, of course, the percentage of coverage will be 0%. And approximately, if they have greater of 11, approximately they should be paid around $1,500.
Llegan las prestaciones económicas de PS llegan a un mayor número de beneficiarios, pero los
And the
programas
BPS
sociales
economic programs reach a
básicamente
greater number
le
of
brindan a las
beneficiaries,
personas
while
mayores
beneficiaries
de
in
bajos
social
ingresos
programs
la
give
oportunidad
low
de acceder
income
a
to
servicios
seniors
que de otra forma,
the
sin
opportunity
lugar a
to
dudas,
access
sería
services that will
difícil
not
lograrlo.
otherwise be available
El
to them
acceso a
in
una
another
vivienda digna,
context,
el
because they have the
acceso a
access
distintas
to a
prestaciones,
dignified
a la
household
tecnología con
or
celulares
the dignified
de
access to the
última
benefits,
generación,
technology of
además
up-to-date
con
technology,
ventaja
as I
incluso
mentioned
gratis para
before.
hablar,
They
sería gratis
receive
para
free
navegar.
minutes to
Si no
call
tuvieran
or just to talk with others. So if they haven't,
sería difícil.
if they don't have this kind of benefits, it will be worse for them to get to this or to have access to these benefits. And also, the recreation locations are distributed around the country. And so they have to leverage all these benefits from the Social Security through the Social Security Bank. Thank you very much.
Muchas gracias, Daniel. Bueno, creo
Thank
que
you
nos ha
very much,
presentado
Daniel.
un extenso panorama de posibilidades y
Thank
iniciativas
you
y de
very much,
programas
Daniel. You have already provided with a
prestaciones
high number of
población
possibilities in which the
caso
population
los
should leverage with.
a cargo del BPS.
And thank you very much for all the things that you provided in the BPS.
Dos primeras exposiciones hemos visto
And this is very interesting because in the two first expositions, we have already talked about the national framework. And actually, this presentation should be complemented by the different specific actions and how this is provided and how the human right of the elderly people is already established and addressed so they can access to different mechanisms or information technology tools. And also, they should be able to access to the adequate sites in terms of healthcare or technology. So we have to face the different situations from the real life to the future things based on different programs and systems. Okay, so we will continue to the questions and the Q&A part of this session.
Para darle traslado a nuestros expositores.
Okay, so I will read the questions. And we have here Ivan Diaz from Guatemala. This question is for Daniel. So for people, all the elderly people more than 55 years old or in extreme poverty, do they receive an economical amount of money by the state?
Como les comentaba, hay prestaciones que son no
Yes, I was
contributivas,
mentioning there are non-contributory
donde el
benefits
Estado, ante
in which the
dificultades,
state,
prioriza
in face of
pronto la
difficulties in
negligencia
terms of economical
de
difficulties,
recursos,
the
por lo
people, the
tanto, lo
person should
asiste,
cover all
aún
the resources.
no habiendo hecho
Actually, the
aportes
BPS,
de
they
su
support this
etapa
person even
laboral,
though
pero sí, claro, el
they
Estado
have not
presta
covered
un
or
apoyo de
provided their
carácter
contributions
económico,
during
que
the
además,
work
paréntesis,
stage.
por ejemplo, cuando yo les comentaba de la posibilidad de acceder
For example,
a
when
la
I was mentioning
tecnología,
the
también
possibility to
las
access
prestaciones no
technology,
contributivas de
they
hace muy poco
also
tiempo, tanto
have been provided with this
como la
benefit
validez
because
del Estado le da la
just a few
oportunidad
years
también de acceder
ago,
a otro tipo de
actually
prestaciones,
they are able to
por
access to
ejemplo,
different kind
a
of
un
benefits
ingreso
even though they have
básico
not been
que se
contributed
refiere
before.
a la pensión propiamente dicha.
Muchas gracias.
Okay, thank you very
Ahora
much.
Berta Brusiolowski de España. Una
Now
pregunta
we
para
have a
Mónica.
Berta Lucianowski
Buenas
from
tardes desde
Spain.
Madrid. Como
This is a
arquitecta
question for
trabajo en
Monica. Thank
diseño
you
con
very
calidad
much.
para
As an
diferentes
architect, I
empresas
work in a
situaciones de
high quality
emprendimiento para la autonomía
buildings
y la salud
for the
física
autonomy and the
y
physical
salud de las
healthcare
personas
for the
mayores.
elderly people.
Deseo saber si se
I would
está
like to know
y se está en algún país trabajando con
if any
enfoque
country
ambiental y
is starting
arquitectónico.
working in an architectural building,
Con enfoque
sustainability
ambiental y
building
arquitectónico.
progress or program.
No
Sí,
entendí.
correcto.
In terms of our
No
architect
conozco el
systems,
resto
do
de
you
los países.
mean?
Mucho no
Well,
entiendo
actually,
las
I don't
preguntas,
know
pero con enfoque
exactly
de
the
arquitectura
main
gerontológica sí son las
scope of
viviendas que
other
nosotros
countries.
hicimos.
However, yes, actually,
La verdad que
based on the
yo no soy una especialista en el
architecting
tema, así
system,
que
we
mucho
have
por ahí
already
no le
created
entiendo. No
some
conozco,
houses, but I'm not
no
an
sé en
expert
caso de
on
Uruguay
this
si tienen las
topic.
viviendas
But I don't
hace
know if in
muchísimos
case of
años, como bien lo
Uruguay,
planteó
if they
Daniel,
have
pero no
already
sé, no conozco si
built
tienen
different
enfoque
house
ambiental o arquitectónico. En todo caso, eso
householding, but
pueden
I don't know if in
comentar, yo
terms
no tengo
of
que levantar la mano. Las viviendas que nosotros
architects,
hicimos, las
I don't know
hicimos con un
exactly.
enfoque de arquitectura gerontológica, son viviendas colaborativas y por supuesto en terrenos
Yes, in
accesibles,
terms of
cercanos a los
architecture, we have
servicios de la
already
ciudad,
established different
con mucho parque
householding
hacia
based
adentro,
on the needs of the
y eso es lo
societies.
que, lo que se está planteando. Tienen mucho parque, pero no
And
sé si
actually,
es
they
la
have a lot
respuesta,
of
porque
green
no soy una
spaces, but I don't know
persona
exactly the
especialista
answer
en ese
because I'm
tema.
not a specialist on this topic.
Daniel quisiera complementar y
Daniel,
Yolanda.
would you like to complement
Bueno,
this question?
aprovecho la oportunidad y
Yes, okay. So just to
mayoritariamente los complejos
consider
habitacionales de BPS se
this
buscan hacer
question,
cerca,
the
construir
different
cerca de
householding
centros hospitalarios
tend to be
próximos al
built
centro
near
de
to
las
hospitals
ciudades,
or
y la
different medical
inmensa mayoría
centers.
están,
And
sí,
actually, the great majority of them are
muchas de las
there.
viviendas
And most
están
of the
elaboradas,
householding
construidas,
are
diseñadas al
built
efecto
and
de para
designed
habitar personas con discapacidad.
according to the disability or
Yolanda.
people with disabilities needs. Yes,
Correcto.
Yolanda.
Aporte al respecto, en Costa Rica hay un proyecto que tal
Yes,
vez
actually, in
la
Costa
compañera
Rica, we
que hace
have a
consulta
project.
podría ingresar a buscar el Facebook de
We
una
have already
organización que
a
se llama
project.
AJUSE,
So please just
Asociación
go
Josefina Ugalde.
to the
Ellos
Google, which
desarrollaron
look
unas
for
viviendas
a program which is
comunitarias
Alcose,
que
and they created
con
community
accesos pensados a los requerimientos
householding,
de las personas adultas mayores.
and according
Casualmente,
to the
pues está en
needs
una
and
zona
requirements
urbana
of
que
the
está ubicada
elderly
muy
people.
cerca de la
Of
playa.
course, this is not
Ella
located into
conoce un
an
proyecto y se busca
urban location,
poder
but it is near
replicar
to
este
the
proyecto
beach.
con ayuda y apoyo
And this project was
al
created
menos acá
by the support
del Instituto
of
de
the
Vivienda y
Institute
Urbanismo
of
del INVI,
Urbanism and
con
Holding
aportes estatales, porque
Institute.
programas de bien social y ha resultado muy bien y ha
And
tenido la
actually, this has
participación de
provided with good
arquitectos
outcome,
y de la
and
Escuela
they
de
had the
Arquitectura de la Universidad de
participation
Costa
of
Rica. Ha tenido
architects,
muchos
and
estudiantes
the
desarrollando proyectos
Architecture University of
de
Costa Rica has
viviendas
developed a lot of
pensadas para adultos
projects
mayores, y
with
en
the
Costa Rica
creation or
también
the
podría
building
tal
of
vez a buscar por ahí
housing
en
based on the
internet,
needs of
de
the
terminar
elderly
con
people.
ciudades amigables en
So
Costa
please
Rica,
just
que es un
look
proyecto
for
que aquí en
the
Costa Rica está tomando
friendly
mucha fuerza.
housing
De
in
hecho,
Costa Rica
las
on the
municipalidades se
internet, because
certifican
most of the
si cumplen
municipalities
ciertos
are
críteres
already
que
certified,
requiere
and
esta
they
población,
are
¿verdad?
review
Para que
if they
puedan
comply
acceder a
with
este
different
certificado.
requirements, so
Así que
they
estas
can
cosas
just
son muy
get the
buenas aquí.
certification. So I think that this
Muchas
information may
gracias.
be useful for you.
Vamos con una pregunta también para Yolanda,
Okay,
de
we have
Carlos
another
García de México.
question
Considerando que
for
Costa Rica ha
Yolanda.
implementado una política
Okay, so
pública
considering that
dedicada
Costa Rica has
de
established
2020
a
al
policy
2033,
from
la cual
2023
asigna la
2033,
responsabilidad principal
which
de cuidado a la
established the
sociedad pública y al
responsibility for
ministerio,
the
delegando
administrative
el
and
papel
public
de los cuidadores
institutions
informales.
based on the
¿Qué medidas
informal
se han
elderly
adoptado para
population.
garantizar que
What
estas entidades y
measures had
ministerios
been
puedan asumir
taken
eficazmente
so
dichas
the ministries
responsabilidades?
can face these kind of responsibilities?
Ok, vamos a ver. Primero hay que tener en consideración algo
Okay,
muy
so first of all,
importante.
we
Costa
should
Rica tiene muy
consider
claro que el primer
that Costa
decidido sobre la
Rica
persona adulta mayor no es el
has
Estado,
in
es de la
mind
familia.
that this
Costa Rica
elderly
cuenta con un
population
código
support
de
is not the
familia que
state, is the
establece que los
family.
primeros
So we
responsables
should
de las personas
establish a
adultas
family
mayores
code that the
son hermanos,
first
hijos,
responsible people from the
nietos
elderly people
o
are the
nietos del
children,
adulto mayor.
the
Entonces, en este momento
grandchildren, or the
hay un
great
proyecto
great
de ley
children.
en la Asamblea Legislativa para
So
fortalecer
actually,
este
within
código de
the
familia y
administrative
poder sentar más las
institute,
responsabilidades
they have
para no
already
caer en el otro
established
extremo,
to provide different
pretender que
responsibilities, not to
también como
cover
siendo
the
familia,
other part of the
bajo
coin.
criterios a veces increíblemente sorprendentes,
Because
diga no puedo cuidar a un adulto mayor, estar
sometimes
declarado
they
adulto
mention
mayor
that
con
they
abandono, la persona
cannot
adulta
take
mayor
care of
en
an elderly people
abandono,
or person, or
es una
because this
responsabilidad del
person
Estado.
are
Entonces no habría
abandoned,
camas, no habría
and
recursos
they
que pudieran
may
alcanzar
think
el
that
nivel de
the
abandono que se pudiese
abandoning or
entonces generar.
abandonment of the
Entonces
elderly
lo que se
people is
busca es
responsible of the
concientizar de la
government.
responsabilidad de familia
However,
como los
we
primeros responsables de
seek
la persona adulta
to
mayor y que la persona adulta mayor debe declarar en abandono en
create
efecto no tiene nada que ver
understanding and
con que
awareness of
aparezca
the
familia
care of the
numerosa y
elderly, and
entonces el Estado
because
lo asume.
a
Con
family
respecto a
member
la
may support
responsabilidad,
them.
por eso te digo que el primer responsable es
And
el adulto
actually, the
mayor,
main
ese cuidador
responsible
informal que
of
posiblemente es un
this
hijo, una
elderly
hija, una persona que
person
quedó
is
al cuidado de esa
the
persona adulta mayor,
formal
y ya después existen
family
las figuras de
member.
los cuidadores
And
que
then
se
we
preparan
have
para
the
ello, que trabajan de
caregivers that
forma
are prepared for this, or those
remunerada,
that
fines
work
de larga estancia o los familias que
according
pueden pagar
to
por ellos.
their
Con respecto a la
schedule, because they
responsabilidad que tienen
receive
las instituciones
a
cuando la
salary.
política
So in terms
se
of the
planteó y se
institutions, when the
negoció,
policy was already
hay un
established,
compromiso por parte de las
of course, there
instituciones
is
que
a
son parte de la
commitment
política, por eso ellos
by the
no
institutions,
es que
which is
si
part
quieren
of the
participar, o sea, se
policy.
comprometieron
So
con la
they
política.
don't decide if they
Entonces,
want to
como esta
participate.
política está
So
en
this is part
constante
of the
revisión por
policy.
parte de los adultos
And
mayores, que cada
because
3 meses
this
nos pasan
policy
un informe de
is
cómo avanzan
under
o no
constant
avanzan,
revision or
entonces nosotros
evaluation,
nos sentamos a
of
dialogar con
course,
esas
we have
instancias
to
para que
start
puedan rendirnos por qué no ha avanzado en
commenting
un
and
punto o está
why
atrasado o si
we
estamos
have
al día.
not progressing
Así,
in
esta política
different
viene arrancando, se
states or
presentó al
points of the
Semesur el año
policy.
pasado y ya
And
estamos
actually,
en la
this policy
conformación de
was
los núcleos de
presented
las
on
personas
the
adultas
last
mayores, que
October,
son los
and we
primeros
have already working
fiscalizadores
on the
municipales.
elderly
Entonces,
people,
por
which
eso,
are
como
the
les digo, antes
first
de que termine el año, el
characters
Consejo
of this
Consultivo ya está
process.
conformado
And
para
before we
ese primer paso
concluded
y
this
estamos corriendo fuerte
consultancy
para que antes de que
progress,
cierre el año
we
ya el
have
Consejo
already
Consultivo de adultos
working
mayores esté
on
conformado.
these
Pero partimos de
groups
la
to
buena
conform
voluntad
all the
y el
policy or
compromiso
the
asumido cuando
committed.
la política se publicó, ya se había hecho
So
todo
when the
ese
policy
trabajo
was
de
already published, we have
coordinación
already
interinstitucional y
made
de
the
compromiso
coordination within the
plasmado en el
institutions
compromiso.
and the commitment,
Muchas
which is already
gracias.
established in the planning
Alicia
process.
Monfante de Panamá.
Okay, thank you very
Felicidades a
much.
los organizadores. Considero que hay que trabajar por la cultura.
Congratulations to
Una
all the
pregunta para
speakers, and I
Mónica,
want
que
to mention that
cómo
we should
cambiar
continue working on the
este enfoque.
culture.
Las personas
How can
mayores
we
productivas
change
y
this
brindan un
vision?
legado a nuestras
Because
vidas.
all productive elderly people provide us with a legacy to our lives.
Mónica.
Monica?
Tal vez conexión con Mónica. Mónica.
I think that we lost connection with
Regulado el
Monica.
micrófono. No, bueno.
Monica, you are muted.
Si quieren, vamos a pasar una
Okay,
pregunta
let's
para
continue to another
Daniel,
question to Daniel.
del Perú, Juan Lozada.
From Peru, Juan Lozada. Hello, good afternoon from Peru. And I think that most of the actions on the elderly people scope has to do with all people that has already executed a profession or a remunerated profession. However, according to the Latin America reality, this is not happening like that. So there are many people that still work in the informality. I would like to hear about your opinion. Yes, actually, historically,
con la gente joven,
we
con los
have
niños y
worked a
tratar
lot
de
with the young people
buscar
and children
portales que
because
tiene
we
para
try to
fortalecer. Ustedes
strengthen
saben
their
que luego
informality
de la
sector.
pandemia, por
As you
ejemplo,
may know,
cuando
after the
esperábamos que la
pandemic,
informalidad iba a aumentar, que la cuestión se dio
when
un
we
proceso
expected
inverso,
the
nuestro
informality will
organismo estuvo
be
muy activo
exceeded,
apoyando a distintos
of course, we continue
colectivos
working
productos
a
de
different
la pandemia. Y de
population
ahí
due
la
to the pandemic.
importancia que
And that is
nosotros los
why
expertos, esa podría ser una de las
And that
razones
is
para
why
las
it's
cuales bajar la
important just to
informalidad
consider
en un
these
periodo
kind
como tal
of
sería
reasons
acortar.
to
Los años pasan,
decrease the
Uruguay tiene algunas
informality.
dificultades,
Of
por lo que
course,
decía en
Uruguay
el
had
norte,
different
ahí históricamente
difficulties in the
se
north
estaba
part of
financiando
the
la gente
country,
del otro lado de la frontera y después los aportes no estaban. Pero yo creo que
and
es
most
un
of
tema
the
de
supports are not getting
trabajarlo
there.
con los jóvenes,
So I think
demostrar
that we should keep working
lo
with
que
young
dice el
people
sistema de seguridad social
and
de nuestro
show
país no
that
es
the
solo
different social security
jubilaciones y
systems is
pensiones, sino también
not
la
covering, it's
cantidad
not
de
only
prestaciones
covering the
y
pensions, but
actividad que se
also
dan a lo
we
largo
have some
del
other
periodo
types of
paciente. Esto
benefits
creo que
that are
pasa
covering the
por
different stages
persuadir,
of their
por
lives.
informar a
So
la gente
we
de las
have
bondades
to
que
keep
tiene
informing
hacer
people
sus
on
aportes
their
a la
opportunities they
SGP.
will get if they contribute
Muchas
to the
gracias,
social
Daniel.
security
Veo
system.
que ya Mónica se
Okay, thank you
pudo
very much, Danielle.
No sé qué
integrar.
pasó.
Oh, thank you very much,
¿Escuchaste la
Monica, for
pregunta
joining
o
us
te la repito?
again. Did
Escuché
you
la
hear
pregunta
about the
y
question?
realmente es haciendo esto
Yes.
lo que hacemos
So
acá.
my
Nosotros
answer is as
necesitamos
follows.
hacer mucha
So we need
promoción de lo que es el
better promotion
envejecimiento
on
con
the
datos
aging or
estadísticos. Hay que hacer
old age.
investigaciones también.
So we should
Porque
keep
esto
working
está,
on the
empezó en
research
rojo
because
sobre la
this
cantidad de
information or
emprendedores,
data
en
on the
lo que
number
se
of
invierte en
businessmen
salud,
or
después una
how
mayor en la
what
seguridad
is
social, pero
been investing
también
on healthcare
comparado
and
con
social
con
security,
lo que ellos
but
aportan, necesitamos más
compare on
investigaciones
their
para
contributions,
demostrar
we need more
lo
research
productiva que es la
to
vejez, ¿no? Y
show
lo
how
importante que es la vejez.
productive
Hay
is
muchas
the
charlas de
old age.
sensibilización.
And of course,
También
just to
hay que
provide
empoderar
different
a las
meetings for
personas mayores. Las
sensibilization
propias
and to
personas
support the
mayores son las
elderly
que
people,
tienen que
because the
hacer,
elderly people
así
are
como
the
nació el
ones
feminismo y demostró
as
que las
well,
mujeres
for
valíamos
example, such as
mucho,
the
también tiene
feminism
que haber un
or
movimiento
the
fuerte
age
de
equality,
personas
the
mayores
old
que
people
estén
should
proclamando
also
y exigiendo sus
strength
derechos.
on just to
Muchas
continue talking
gracias.
about their human rights.
Una pregunta para Yolanda.
Okay, so now we have a question for Yolanda.
¿Conectó?
Is Yolanda here?
Bueno, Yolanda, sé que me estás escuchando. Dice,
Yolanda, I
nuestro
think that you are
país
listening to
presentó
me.
la política
So
nacional de
our country
envejecimiento. Me
presented
pregunta la
the
siguiente.
aging
¿Está
policy.
cumpliendo todos los puestos en esa
So are
política?
we
Me
already
preocupa
complying with all
mucho
the
que
requirements
el gobierno
of
actual
this
cortó el
policy?
presupuesto
And
del
this
CONAPAM,
is,
entonces los
and
programas
I'm
que
very impressed
atienden a los
because
adultos
the
mayores cómo quedan.
CONAPAM Institute
Entonces,
are
Yolanda,
not covering all the benefits for the elderly people.
ya.
A
Yolanda,
veces no hay hambre, pero se necesita el glamour. Vamos a darle una vuelta de arriba.
Sonido. Sí, correcto. Bueno, para dar respuesta a la consulta,
Just to
básicamente
answer this
el
question,
presupuesto no ha sido
basically
recortado.
the
De hecho,
budget has not been
siempre
lowered
como puede pasar, ¿verdad? Que a nivel presupuestario, en algún
because in
momento hay un
terms of
recorte
a
de presupuesto,
budget,
pero en
we
este
can just lower
momento
the budget, but at this
gobierno
time,
asegura
the
los presupuestos
government
establecidos ya desde el
ensured
año
all the
pasado para el año
budget already
2024
established for
y tenemos ya
2024,
seguridad de parte
and
de Hacienda, del Ministerio de
we
Hacienda,
have the
que los
support
presupuestos
by
asignados
the
para el Consejo Nacional de la
tax
Persona Adulta
agency
Mayor para el
just to
año
ensure the
2025 se
contributions for
contempla.
the elderly
Recordemos que
people.
nosotros
So for
dependemos de la
2025 is already
recaudación
contemplated.
del Estado bajo las dos leyes, que es la
Just
ley
remember that we
que
are
recauda
based
desde los
on the
impuestos
different
de
laws that
cigarros y
recover
licores
the
y del
different budget
71, 72,
on
79,
the
72 y
72
de
or
la ley
73 law and the
9188, que es la
law
ley
9188,
de
which
asignación
is
familiar
the law for the allocation for
pero
the
hasta el momento,
families.
como le indico,
But
no tenemos
we
indicación de
are
que haya
not
habido
currently having any
de
information that
estos presupuestos y
we
contamos
are
con los
having a
recursos que ya han sido
lower
asignados,
budget
¿verdad?
for all
Para los
the
otros años,
resources
26 habría que
allocated.
esperar en aquel
So
momento, pero
for
de
the
momento, como le
following
indico,
years, we
24,
should keep waiting.
2025 tenemos los
But
recursos
for
asignados
2024,
y asegurados
2025,
por
we already
parte
have
del
all
Ministerio de
the
Hacienda. Y sí,
resources already
tomamos este
allocated.
proyecto, esta política con la mejor actitud y el mejor deseo
And of
de que
course,
pueda
we try to
ejecutarse de la mejor
working
forma.
and just to
Sabemos que es una
execute
población
this
creciente que
correctly.
esperamos
And we
que los
all know
recursos año con
that
año
this is
puedan
a growing
incrementarse, no al nivel que
population.
nosotros
Then
queremos,
of
porque como le
course we
indico,
can just keep
depende de la
working on the
recaudación
contributions, but it
de estas dos
depends
leyes,
on the
a través de
allocation
estos dos
and
mecanismos
ratification
que
of these
nosotros
two
recibimos
laws and these
recursos.
two
Admiro
mechanisms
mucho y
to
me
which
gustó mucho
we
la
receive
posición de doña
mechanisms.
Mónica
Thank you
cuando
very
decía que
much.
es una
Actually, I
población que no
really
es un
like
gasto,
the
sino
comment
que
of
realmente
Monica
ellos
because she
aportaron en su
mentioned that
momento y
aging
que
is
hoy
not
por hoy
an
la sociedad y el país y
expenditure,
cada
but
nación debe
also
de reintegrarles en mejores
but they are
servicios de
a
atención,
good tool for
devolverles
the
lo que
growing
ellos ya
of
nos
the
dieron como
state because
país
of
y
course
como
we can
personas desde
just
sus áreas.
providing them
Merecen, por
back
tanto, toda
what
la
they have
inversión
already
de
contributed to the
reintegro, de
country.
devolución, porque así lo merecen.
Muy bien, muchas gracias. Yo creo que esta pregunta puede ir para los tres expositores. ¿Podrían detallar cómo se
So this
completa la
this
perspectiva de
question is
género
for the
para
the
construir un sistema
lecturers.
integral de protección a la vejez,
So just to constitute
especialmente
a
como referente a
aging
las
in
acciones
comprehensive
para cubrir las
system?
necesidades de las mujeres
What are all
mayores?
those actions to cover or just to
No
integrate
sé si
the
quieren
elder
que
women?
empiezo. Bueno, por empezar, esto que yo planteaba, por ejemplo,
Yes,
de los,
actually,
en
what I
cada
was
una de las
mentioning
políticas
is
tiene que
that
haber
in
una
each of the
mirada
policies we should
de
consider
género.
the
Entonces,
gender.
cuando hablamos de
So when we
violencia,
talk
sepamos que las
about
personas que más
violence,
violentadas son
we
las
should
mujeres.
consider that the
¿Cuántos
most
centros de abordaje a
violent,
las violencias de
the
personas
people
mayores
that
hay
receive
en la
more
región?
violence
Uno
are
solo
the
aquí en
women.
Argentina, que lo hicimos nosotros en PAMI. Un centro
So we
específico de
have a
abordaje a las
specific
violencias
center
de
to
género y
address
diversidad sexual
violence
para
of the
personas
gender and
mayores,
sexual diversity
no
for the
hay en
elder
otra región.
people was already established
Esto
in Argentina, and this is
lo
PAMI. And
hicimos
actually, we don't have
en las
any
misiones
other
de
in our
Tucumán cuando estuve
region.
en PAMI.
So
No
we
es lo mismo el
create this
abordaje a las violencias en
in terms
mujeres
when we
de
address
30,
PAMI. So
40,
of course, we don't
25,
have any other
50 que
information for the
mujeres de
violence
60,
provided
80, 90. La mirada es
for
absolutamente
women
diferente, el
around 50
abordaje es
and 60
diferente y la
years
gente
old.
tiene que estudiar
However,
una
we
especialidad
should consider
diferente. Entonces, si voy a armar una política
different
para
aspects
combatir
or
la violencia
scopes
de
to
género, tiene que
address this
pensar
kind
en las
of the
mujeres
gender
mayores.
violence.
Si
So
voy
we
a
should
armar
consider
un
the older
programa de
women.
salud
So
sexual
I will
y
create a
reproductiva,
sexual
tengo que
program for
pensar en salud
reproduction.
sexual
I
reproductiva y
should
no
consider
reproductiva,
the
porque las
sexual
personas
reproduction
mayores, los varones
system for the
reproducen
elderly people because, of
hasta edades
course,
muy
the
avanzadas y
men,
las
older
mujeres
men,
ya no tanto a partir de
can
los 60,
uh,
pero
can be
todos los
reproduced
programas de salud
over
sexual y
60 years old.
reproductiva
However, this reproductive
son
and
hasta los
sexual
45 años las
culture
mujeres, 55 los
should be
varones.
provided for
Entonces, tengo
the
que hacer
older people
educación sexual
because
no
for
solamente en las
women, they are
personas
covering the
jóvenes, la
45
educación
until
sexual
45
integral
years
tiene
old.
que ser
So the
personas
systems for
mayores, pensar en las
comprehensive
mujeres, porque en mi país el grupo que más
sexual
aumentó el
system
HIV
should be considered all women.
del grupo de personas mayores que aumentó el HIV, no disminuyó, cuando los otros grupos por ahí disminuye, en las personas mayores aumentó, el que más aumentó es en
So,
las
for
mujeres.
example, for
Entonces,
between all
digo,
the
cuando
countries
hablamos de
that
seguridad
consider
social
these
y sabemos
scopes
que
between the
una de
elderly
cada 11
people,
mujeres en mi
women
país al menos
receive the highest rate.
completa los 30 años de aporte que son obligatorios para adquirir una
So if
jubilación,
people
entonces
comply
yo
with the
tengo que
more than
poner
30 years
justamente una
of
política de inclusión a
working,
las
we
mujeres.
should
¿Cuál es?
continue working of an
Reconocerle la
inclusive
cantidad
policy for
de
women
hijos, de
in which
hijas, de
they
nietos que
acknowledge the
tiene
number
en el
of
reconocimiento de
girls
los años de aporte a la
and
seguridad
little
social.
girls,
Cuando tengo que
and this is
trabajar
how they
de
have to
manera
provide
para
for
los
to
de
contribute for
abajo
the social
y por
security.
supuesto romper el techo de
And of
cristal,
course,
que se
just
haga justo y
to
establezca la
break
igualdad que
the
tenemos las
scope
mujeres
that we
de
all
acuerdo
women have
a la
according
condición.
to
Podría
the
hablar horas
condition.
de esto,
And
por eso
actually, I
acá,
can
pero
just
podría
keep
hablar
talking
horas
about it
porque el grupo más
because
discriminado de todos
the
los
most
grupos que hay en
discriminated
la
group
vida
within the
humana es el
groups
de las
in the
mujeres
human
mayores.
being are
Gracias, Mónica.
the older
Daniel.
women.
En un momento de la intervención se dijo por ahí, Uruguay tiene,
Yes,
por ejemplo,
actually, in a part of this question, you have mentioned that Uruguay acknowledged a 1 year for each of the children. And actually, in this case, we have generated different policies. And there's a director that is in charge of this area. Then she also shares this thinking from other institutions of the state, and also some other officials of the Social Security Bank that work in this regard.
Sí, básicamente coincido
Yes,
con
Yolanda.
Mónica. Vamos a
Yes,
ver,
actually, I agree with Monica.
lastimosamente nos cuesta tener esa
Unfortunately,
claridad,
we
¿verdad? En una
have
sociedad
some
lastimosamente
difficulty
que
to
continúa siendo muy
understand
machista,
a society
con una
because we
visión
live in
totalmente
a
distinta de la mujer.
man
Entonces, ser
vision
mujer, ser adulta mayor, si le
population.
agregamos a esto otras variables como su
And we
orientación
add some
sexual, ¿verdad?
other
Se vuelve
variables as
todavía
the
más, se va cerrando,
sexual
¿verdad?
orientation.
Este
We
embudo
keep
de que
closing
vemos
this
todavía con
gap,
otra visión,
opening this gap,
con otros
because we
lentes
have
a
to
a la
try
población adulta mayor. Entonces,
uh,
definitivamente, al menos en la
observing
construcción de la política de
differently
envejecimiento y vejez en
the
nuestro país
older
participó el
people.
Instituto,
And
el INAMO,
actually, in
¿verdad?
our country, we have the
Para poder
participation
resguardar
of
esa visión,
INAMO
pero dentro
to
del
continue
grupo de las
working on
mujeres,
this
la
vision.
población
But
adulta mayor
within the
debe
older
de tener
population
totalmente
in the women
una
sector,
visión de abordaje
they
diferente,
should
que
have
creo que con el
another
paso del
way of
tiempo
thinking,
esperamos en
because
Dios que
and
podamos
while we are
ir
working on
tomando esa
this, I
conciencia
hope that we can
de que
have
nuestra población
another
adulta mayor
point
y en
of
el
view
caso de
and
las mujeres
awareness
adultas mayores
that our
debe de tener
older women should
una
have
visión
a
muy clara de que sus
clear
valores y sus
vision
requerimientos son
that their
totalmente
requirements, our
distintos
needs are
y deben de
totally
ser tomados en
different,
cuenta
and
esas
that they
variables
should be considered
particulares de
into
nuestra población
consideration,
adulta mayor
because
de
there are
mujeres.
certain particular things that should be considered
Gracias.
within our older women
Esto
population.
más que una pregunta me parece que nos lleva a una reflexión.
We have
Voy a
another
leer
question that
el
can
libro
provide us a
Me
reflection.
parece que en general solo están considerando a la
And I
población
think
de
that in
adultos
general,
mayores funcionales.
you are
Pero,
only
¿qué sucede
considered
con
the
aquellas
functional
personas
older
mayores que presentan
population?
ya un grado de
However, what will
discapacidad o
happen with
discapacidad
all
mayor,
people that
por
have a
ejemplo, problemas
major
de movilidad y
disability?
o
For
deterioro
example,
cognitivo?
people
Pero
that have a cognitive
entiendo,
disability.
en el caso del BPS, pues
So
se
I
hacen acciones,
understand
pero
that in case of the PPS,
no
they
de igual
take
manera.
concrete actions.
Pasa en
However, I would like
Argentina
to
y
hear about
Costa
it. So I
Rica.
think that this might also
Quisiera de
happening
pronto
in Argentina,
que
Costa Rica.
fueran un poquito más específicos, que
However,
nos den
could you
algunas
please be more
experiencias o algunas
specific if
acciones
you
para
know
poder
different
acceder a la
experiences of you
solicitud
have taken different
del
actions that
permiso.
may be able to answer
Sí,
the
sí, claro,
question?
yo planteé ahí en el artículo 12 la política de
Yes, and
cuidado, lo que
actually
pasa es
in
que no quería
Article
explayarme
12,
tanto.
I was
Como es
mentioning
Argentina,
the
el
disability
primer
care.
programa de
So
cuidados
the first
domiciliarios
program
que estuvo en la
for
región de América Latina
housing
de
care
América
was
Latina es en
established in
Argentina en
Latin
el año
America is the one in
1996,
Argentina
a
in
través del Ministerio de
1996
Desarrollo Social.
from
Entonces
the
tiene
National
ya
Council for the
unos
Social
muchísimos
Development.
años. Y PAMI, que es el Seguro de la Obra
And
Social, el
PAMI, which is
Salud
now
Sociosanitario,
the
que nosotros estamos hace como 4 años,
sanitary
sí tiene un programa de
healthcare
atención a
system,
domicilio que tiene
it
más de
already
7.000
has an
personas
attention or care
bajo
attention
que le da
program,
subsidio para pagar el cuidado
which
obligatorio.
provides a
Tiene un programa de
subsidy for the
internación inclusiva
caregivers. And also
domiciliaria
they have
y en
some
ese
other
orden. Y
international
nosotros, como les
caregivers
comentaba, cuando hicimos el
programs.
convenio para desarrollar las
And
viviendas, construimos, así como
when we created this
planteamos 100
convention,
centros,
we
100
established
complejos de vivienda con
different
100 centros de día,
housing
porque los centros de día son
location,
escasos. Hoy PAMI
because
tiene alrededor
the
de
daily
70,
or the
contrata,
day
¿no? Son
locations
solamente los que
are
contratan la
already
prestación de
hidden by the
70
different
centros de día,
benefits.
pero es una prestación en general en toda la región.
However,
Es una
this is
prestación
a
sumamente
benefit
escasa, un
provided
servicio que
for the most of the
prácticamente está en
region.
desarrollo, es muy incipiente y sin embargo es
And
sumamente
this is
necesario.
still in
Nosotros
development.
creamos ahí
And
lo
also,
que son
this
los
is
centros
necessary
de
to continue
día
working on that.
para la atención de
Now, in
personas
the
con
day
dependencia
centers
moderada,
are
las
part
que yo
for
estuve
the
en PAMI,
moderate
esa
care
política
people.
continúa,
And actually, based on the
porque en
policy of
general
PAMI, we
se tienen
continue to
centros
do
de día
so.
para
And
atender
actually, we
más
have some other day
socioafectivo, atender
centers just
personas que
to
tienen
continue
una
working with
dependencia leve. Bueno, no,
for different
nosotros
activities
armamos
for those people
17
that
centros de día para atención
have lower
a
dependency.
personas que tienen dependencia
But we
moderada y
actually
además
create this kind of
incorporamos por primera
dependencies
vez
for
en
all people that
Argentina
have
los
moderate
centros de día
dependency as
especializados
well.
para Alzheimer, que es algo que
And
tampoco
there are some
hay mucho en
other
España,
facilities which is based for the
prácticamente
summer,
no hay
because they
en
are
nuestra
actually
región
we
una atención
don't have
especial, específica a la
many
comunidad. Como dije
specific
al principio, la
locations for
atención
this
tiene que
kind of
ser
community,
fundamentalmente
because
comunitaria.
as I
Y
was
aquellas
mentioning,
personas que tienen
this
una
care should
dependencia
be
severa van
for
a
the
la residencia
community.
larga estancia.
And for all those
Nosotros en
people that
Argentina
need
tenemos
severe
4.040
care,
residencias
they go to the different long-term residencies. Now, PAMI has more than 560 residences. And actually, we change our point of view and the attention model because these are residences free needs because we provided with the private bathrooms, with the different independent areas, or people that treat, they take caregivers or the clients as well because they provide a psychologist or a gerontologist. So it's different. All the residences that are already hired by PAMI or with the high level residencies for the population. And now these institutions are part of the federal government, and each of them has their own laws that regulate this kind of housing care and residency and day centers. So these are the policies that were developed in PAMI.
Daniel o Yolanda,
¿Puedo
Daniel
agregar?
or Yolanda?
adelante.
Bueno,
Yes, go ahead.
Yolanda, si tú querés. Sí,
Yolanda,
yo-
please go ahead.
Sí,
You're
ok,
first.
gracias por cederme la
Okay,
palabra.
thank you very
Sí,
much.
básicamente nosotros estamos detrás de Mónica.
Yes,
O sea, Costa
actually,
Rica está en un
we are
proceso
working alongside
en el
with
año
Monica's
2022
Institute
se
because in
publica y entra en vigencia
2022
la ley
we
5, que es
published
la ley de
the
cuidados, ¿verdad? Donde
CINCA
vuelve
law,
la
which
vista
is the
totalmente
care
dentro de la
law
población adulta mayor
that
a aquella
consider the
población que
elderly
tiene
people because old
dependencia y
people
requiere de
that
cuidados.
has
Estamos
higher dependency and care.
en el punto exacto
So
del
we
cambio de
are
paradigma,
in the
¿verdad? Costa Rica
exact
tiene cerca
point
de
to continue working with the change
de
of
200
vision.
instituciones, organizaciones de
Because Costa
bienestar
Rica
social que
has more than
atienden a personas adultas
200
mayores con un subsidio por
locations
parte
that
del Estado.
care for the elderly people
Pero hoy
based
por
on
hoy,
the state
la
subsidy.
gran mayoría de personas que tienen algún grado
However, a great
de
number
deterioro
of people
cognitivo o de discapacidad física no
have
son las que nos están
cognitive
asistiendo a los
impairment,
centros de día,
all those
¿verdad?
people
Sino que
that don't
básicamente son
belong to
personas bastante funcionales y lo que
centers
estamos
because
buscando es pensando y
they
dándonos
are
cuenta
functional
que en
people.
efecto
So
las
we
personas que
are
más requieren de
thinking
estos
and
espacios
realizing that
de
all people
atenciones de centros
that
de día
needs
y de crear
or that need
realmente
these day
una red
centers or
de
the ones
apoyo a
that
las personas
need
en su
a
casa, de
support
asistencia y de
network
cuidados
based on their family
especiales,
members or special
a través de los
care
recursos que
will
recibe el
be
CONAPAN,
through their
es de crear
resources
junto en alianza con el Instituto
received
Mixto
by
de
the
Ayuda Social de
CONAPAM,
Limas en
and
nuestro
also
país,
we should continue
la
working
creación de
with the
estas
Lima
asistencias
institutions on the
domiciliares con
creation of
recursos
this
estatales
housing
y que
institute
realmente
based on
nuestros
the
hogares de
state
larga estancia, que hoy
budget,
por hoy pues sí
and
tienen
also to
personas con
create a
dependencia,
long-term
o
residencies for
encamaditas, con
people with
deterioro
a
físico,
higher
deterioro cognitivo,
dependency or with cognitive
mayoritariamente ahí solo
impairment.
llegue esta población y las
And
otras
this
personas
population
las
should
podamos
be
mantener
located
en otro
there,
tipo de programas.
and the
Por
other kind
eso
of
les
population
comento
will
que
receive
Costa
some
Rica
other
está en un
kind of
momento
programs.
de
Now,
cambio de
Costa
paradigma,
Rica
de
is
valorar nuevamente lo
already
que estamos haciendo, que luego se viene
changing
haciendo
their
bien,
point of
pero los
view, and
tiempos
actually
demandan
we have
cambios
working a
en
lot of
nuestros
this,
programas
but
para
we
atender
need
a esta
different
población
changes in our programs
institucionalizada
to continue
realmente,
working
¿verdad?
with this
Que
kind of
califica con un
population,
grado total de
primarily for
dependencia
all the
y que realmente es la
population that
población que está
needs higher
funcional, autónoma,
dependency
independiente o con
care.
algún grado de discapacidad, pero manejable, pueda estar en otro
Or
tipo de
those people
programas
that have
dentro de la
a different
comunidad
kind of
y no
disability, but they're still
institucionalizada.
manageable, they will be able to be
Bien.
referred to some
Sí,
other
yo les
institutions.
comentaba en
Yes,
parte de
Daniel.
mi intervención sobre el Sistema Nacional de
Yes,
Cuidados
actually, I
en
was
Uruguay en
mentioning
los
about
últimos
the
32 años,
healthcare program
la
here in Uruguay.
posibilidad que tiene
And many years ago, we have had the
llegar
possibility
a un subsidio
to the beneficiaries to
total
receive this kind of contribution
para
according
estar
to
acompañados
their
cuando sufren algún tipo de
years
perturbación
of
personomateria,
working.
es decir,
And of course,
reciben
the
de
people that have the
recursos
kind of disability, they will receive treatment
dados
for
por el
experts.
propio Ministerio de Desarrollo Social.
And actually,
Los
the
hogares
Social
para
Development
adultos mayores,
Institute
donde hay una
has
presencia muy
created different
importante del
residences for the
Estado.
elderly
Lo que se
people,
está
which is
dando
already
en Uruguay,
responsible
como
for the
ustedes saben,
state.
es un proceso
Now,
de
in
envejecimiento de
Uruguay, as you
esta
may know, this
población.
is a
Uruguay
elderly
tiene
process for
además
the rest of the
índices de
population
natalidad muy
because we
bajos
have to consider
y en
the
estos
lower
hogares,
rates
por
of
supuesto que
natality.
se está notando
And
la
of course,
dependencia, se está
we can
acentuando
see
la
the
dependencia
dependency
en
or
estos centros.
dependency
Hay
is
centros
being
también de
increasing.
día donde concurren
And also for the day
adultos,
centers in
personas
which
mayores de
different
dependencia
people
y
with
siempre está
disability or
el Estado no
dependency
solamente
refer to.
del Banco de Previsión Social o el
And not
Ministerio de
only the
Desarrollo
Social
Social, sino de
Security
otras
bank
instituciones. en muchas ocasiones
is
también
responsible of this, but
las
some other
intendencias que son las
institutions.
que dirigen los departamentos de nuestro país.
But there are some other
Principal
instances
referente
that
de cada uno de
manage
los departamentos
these
es el
issues
intendente
in the
que tiene
different departments.
asistencia directa
And these
para las
departments
personas
provide
mayores, también
direct
con
assistance to the
distintos
elderly
programas
people
o
with the
métodos
different
similares
kind of programs.
parecidos a los que
Some of them are
nosotros
similar to those that we may have here in some other institutions or the
Muchas
BBS.
gracias.
Thank you very
Bueno, dado
much.
ya lo avanzado de la hora, yo quisiera primero agradecer a todos los
Okay,
participantes
first of
que nos
all, before we can conclude, I want to thank to all the participants and, of course, the lecturers that have provided us with their different insights on the aging topic towards a fulfilling life. And I would like to conclude with two important insights. First of all the topics or all the insights developed by Monica, Hector, and Yolanda is that the main responsibility is the population, the society. And also, as Monica mentioned, how can we develop this? And of course, with this kind of meetings, just to continue working or just to have a great knowledge on the rights, not only for the contributions and benefits that our systems provide, because there might be not enough, or maybe because the older or the elderly population don't know about their rights. So now the Inter-American Center for Social Security Studies has this purpose, this objective to contribute and just to disseminate the information. And also because the Social Security institutions can just change themselves. And all the knowledge already acquired from the different countries, and not only based on the internal standards. As you already mentioned, you have already adopted different reforms in Uruguay for the pensions, is to provide different benefits and contributions, or just to have higher access to this kind of benefits. Again, I would like to thank you for your contributions, for all the lecturers, for your insights, for your answers, for all those people that participated with your questions. Actually, we don't have enough time to address all the questions. Now, as Monica mentioned, I just can't keep talking on this topic, but I would like to invite you all to visit our website and just to review all your training programs. And actually, we have already preparing another diploma course and retirement in the workplace. And we want just to relate this topic because the older people or elderly people have the right to work. And so they can just develop themselves in a safety work environment. So we should keep working on changing our behavior. Because all people, all the older people that have already different experiences can just keep growing within the society. Thank you very much. And we should continue contributing on this transformation and growing of the societies. So just we should change the rights. This is not just to change the rights of all elder people, but we should acknowledge their rights as formal as workers in the societies, because just they keep contributing to the society, contributing with your experiences and contributing with the main country's richness. Thank you very much, everyone, and hope you had a good experience here. And just be aware on the following calls for the next topics which are relevant for the societies. Thank you very much. It was a pleasure to being here with you. Thank you very much for everything.
Gracias por la invitación, de verdad, de todo
Thank
corazón de
you
parte
for
de
the
Costa Rica, y estamos a la
invitation on
orden en
behalf
lo
of
que
Costa
podamos
Rica.
aportarles,
And
a la
if we
orden.
can just provide you with some other insights, please let us know.
no crean que con esto se acabó la contribución que tienen que hacer
Okay,
para las
so
Américas.
no,
Ya pronto los
no
llamaremos
worries
para
because we
otros
will continue
propósitos,
working
participar
on
en
these
programas, conferencias, escritos.
proposals
Creo que
for
eso
the
es de mucha
CIESS
utilidad,
for to
pero
continue working
compartirlo
on
con
different webinars
co-ponentes
and
siempre. Entonces,
conference.
muy
And thank you
amables a
very much
todos,
for
que tengan un
sharing
buen
your
resto de
experience
día.
and knowledge. Have a good day. Thank you very much.